Hello, my name is Guliz Barkan. I'm a pathologist and cytopathologist by training. I am currently at Loyola University Medical School. I am the Director of Cytopathology and the Director of the Residency Training Program. But here today I am representing the American Society of Cytopathology. I am the Chair of the Membership Committee, and today we will see a series of interviews with some of our members to commemorate the 16th anniversary of the American Society of Cytopathology. So we will be asking our various members about the ASC, their relationship with the ASC, and how they have come into the field of this wonderful land of cytology. So, listen on. Here we have Ms. Lakshmi Yarlagada. She is the regional supervisor. She's a cytotechnologist and the regional supervisor in the Adventist Laboratory Partners in Hinsdale, Illinois.
Yes.
Welcome.
Thank you.
So, how long have you been a cytotechnologist? How long have you been in the field of cytology?
I worked for 30 years, going on 31. And I went to Michael Reese. I took my cytology certification from Michael Reese Hospital in 1981. And then I'm working at my lab for last 30 years.
That is awesome, unbelievable.
Yeah.
So how did you find your way into the field of cytology? How did you get to know about cytology?
Well, I came with a master's degree from India, and I wanted to go for a PhD.
What was your degree in?
In zoology, specifically limnology and freshwater fisheries. And when I was coming to Chicago, I was very excited that Lake Michigan is right there, lots of fish, lots of freshwater. But when I called around, nobody knew what limnology was. And then for personal reasons, I needed to go into somewhere where I can make money immediately to support my family. So I thought, okay, I will do something temporarily and then I'll go for my PhD. And then somebody told me, one of my classmates from back home was here in Cincinnati. So I called her and she told me about cytology. And then I did histology part during my master's degree. So I said, okay, I will do it. And I applied both for medical technology and cytology. And when I looked at both courses, I liked the cytology better than medical technology. And I'm so glad I went to cytology. It is definitely a better choice. And instead of being a stepping stone, I just fell in love with cytology, and here I am after 30 years and proud to be a cytotechnologist.
Well, we here have Dr. Robert Cabay with us. He is an assistant professor of clinical pathology in the Department of Pathology, College of Medicine, and he also has a joint appointment in the College of Dentistry in the Department of Oral Medicine and Diagnostic Sciences at University of Illinois in Chicago. Quite a mouthful.
I guess so.
We are very happy to have you here with us today.
Well, it's great to be here. Thanks for inviting me to come along.
Sure. So can you tell a little bit about yourself and your unique background?
Sure. Well, I started my professional career as a general dentist with a strong interest in head and neck pathology. So as that interest in pathology grew, I realized that was a path that I would like to take as I moved ahead in my career and actually make that a focus of my career. So I decided to go to medical school, and I did pathology residency at the University of Illinois at Chicago. And during that residency, that's when I really got turned on to cytopathology.
So tell us about it. How did you first learn about the field, and how did you think this was a good field for you to go into?
So right at the beginning of my first cytopathology rotation in my pathology residency program, I realized that there was a really significant head and neck pathology component to it, which fit my background well. The other thing I also realized is that there's a very large component of fine needle aspiration that goes into that and fits very well with my interest in head and neck pathology. So I'm thinking, well, great, I can kind of meld together my interest in head and neck pathology with the performing and interpreting of fine needle aspiration. So that really fit me well. That's something that I really liked and realized, wow, this is something that I could pursue as a career and really leverage my background and possibly, you know, focus in on that as a job as I move forward.
So now you practice as an oral pathologist, head and neck pathologist, and a cytopathologist.
Right, so I kind of bring the two together. I'm primarily a cytopathologist at the University of Illinois Hospital and Health Sciences System, but I also do surgical pathology with a head and neck pathology focus. Just what I really wanted to do.
Perfect. Well, here we have Dr. Jennifer Prather, who is a cytopathology fellow at Loyola University Chicago. She comes to Loyola from the University of Illinois in Chicago, where she did her residency, so she's a true Chicagoan. Welcome, Jennifer.
Thank you.
So tell us, you are a fellow. What made you go into cytology? Why did you choose the field of cytology?
Well, throughout residency, we had a few rotations in cytology, and I felt it was very, very difficult. So I didn't feel like I would be comfortable signing out these cases when I wasn't attending if I didn't have additional training. I felt like the field is huge and there's a large variety, and just 3 months of training wouldn't have been enough for me to sign out cases. So I decided to do a year-long fellowship in cytopathology. So I really feel like it's I directly impact patient care with just a few cells. So I'm very happy with my choice.
How about the ASC, the American Society of Cytopathology? How did you hear about the ASC? Where did you hear about the ASC? Or, you know, when did you choose to become a member? Why?
So when I was talking with my mentor, Dr. Odile David at University of Illinois Chicago, she mentioned that if I was interested in doing a cytopathology fellowship or learning more about cytopathology in general, that I join the ASC. She recommended me for membership, and that's how I started.
There you are. Here we have Dr. Eva Wojcik with us. She is the chair and the Helen M. and Raymond M. Galvin Professor of Pathology and Urology at Loyola University Chicago. She has been the director at Loyola University for years in cytopathology section, as well as the director of the residency program and the director of the pathology fellowship, cytopathology fellowship, and she has mentored numerous residents and fellows over the years. Welcome, Dr. Wojcik.
Hello, Guliz. How are you?
Good. So, Dr. Wojcik, tell us, how did you first hear about the field of cytology, and how did you get involved with cytology? How did you find your way into it?
Well, it seems like I was always in cytopathology and part of this great field. It really started at the beginning of my residency. I started my residency at Metro Health right now in Cleveland. And when I was a second-year resident, Dave Dabbs joined us as a junior faculty. And that was like a revelation for all of us. We thought that he's simply a magician. He was able to make this incredible diagnosis based on few cells. And so that was simply incredible how he could do this. And after that, I moved to Wayne State. Dr. Suzanne Selvaggi was a program director and became my mentor, and great mentor, incredible cytopathologist. And there was really no other way, just do cytopathology. And from there, I went to MD Anderson. Of course, I'm a little bit biased, but as far as I'm concerned, the greatest place for cytopathology. And I worked with Ruth Katz, Nur Snitch, Nancy Caraway, Greg Sterkel. They're all my friends and my mentors, and been there since forever. I have to also tell you that right after MD Anderson, I went to Bahrain, and I was the only cytopathologist in the entire country. I don't know if many of us can say such a thing.
Well, that is
But
incredible.
yes, but it's a very small country.
Tell us about your collagen balls, too. You tell all the residents and fellows about the collagen balls. Who did you work with?
Well, yes. When I was in Detroit, I had the opportunity and great honor to spend 2 months in University of Michigan with Dr. Naylor. And Dr. Naylor definitely was one of my most important mentors as well. And while I was there, we were working on this finding in pelvic washings. And I review all those pelvic washings and kind of associated surgical specimens, and we figured out that the famous collagen balls are originating in majority of the cases from the surface of ovaries. So that's how it started. And that was really my very first platform presentation at ASC, talking about collagen balls. And that's how it started.
Here we have Ms. Jennifer Haya with us. She is a retired cytotechnologist. Welcome, Jennifer.
Thank you.
Can you tell a little bit about yourself and how you found your way into cytology and what positions have you worked at?
Yes, I was working at Ravenswood Hospital as a histotechnologist and also medical secretary. And one of the thoracic surgeons would come in and ask me to pull his bronchial brushing and washing slides so he could look at them himself. I said, well, why do you look at them when we have a pathologist? He said, oh no, he said, we need a cytotechnologist to look at bronchial brushings. Pathologists just don't want to take the time to screen, so I could come and look at my own work. He said, why don't you go into cytology? I said, well, I don't know anything about it. So he told me, well, Michael Reese has a school, and he could recommend me, sponsor me, and he gave me all the information. And I was almost qualified to go into the program, but I needed some more biology. So I took 2 crash courses during the summer, got my biology credits, and applied, and I did get into the program. And at that time, you only needed 2 years of college with a certain number of hours, and the training program was only 6 months. And then after the 6 months, you had to do an internship. So I did my internship at Michael Reese, and then they hired me. So unfortunately, Ravenswood Hospital never got me back as a cytotechnologist. But they did get a cytotechnologist eventually. And in my past work, I have gone back and done some screening there.
And then after Ravenswood, you said, where were you at after?
And I was at Michael Reese.
Michael Reese.
And I was trained there, did my internship there, and I worked there until 1971. Then there was an opening for a supervisor position at Evanston Hospital. I applied for that, which was only 15 minutes from home, whereas Michael Reese was an hour from home. And I got that position, and I loved the job, and I stayed there for 20 years.
Wow.
Then after that, I wanted to do part-time work because I needed time to play tennis and ski and things like that. So there was a great job at Rush North Shore. It was a job sharing with another cytotech. So we did the way we would work 2 days one week and 3 days the next week. And I worked there until 2000. And then I got the job at College of American Pathologists. And I had a great career. Every job I took was better than the other.
Yeah, you seem to have enjoyed your career along.
Very much.
So you must really like cytology.
I do. I love looking at glass slides.
Very nice. Here we have with us Dr. Ritu Nayar, who is a professor of pathology at Northwestern University Feinberg School of Medicine. She is the medical director of cytopathology and the cytopathology fellowship director. She is also our president-elect of the American Society of Cytology. Welcome, Dr. Nayar.
Hi, Guliz. Thank you for having me.
We have a couple of questions for you. And the first one, let's start with, how did you first become involved with the ASC, or how did you first become involved with cytology?
That takes me back many, many years. I was actually a medical student way back in the mid-80s in New Delhi, India, when during my medical school, I got fascinated by pathology, and I knew instantly when I rotated through there that I wanted to do pathology. I didn't know at that time, of course, that cytology would be what I would subspecialize in, but I made up my mind about pathology. And then as I went through my training in India, we actually don't go to college. We go straight from high school into med school. So we're still pretty young when we enter our med school. And then we go into our residency. and I picked pathology, and the discipline of cytology attracted me right away because, as you know, in developing countries, there's a lot of sick people, and the power with which the fine needle aspiration could give you instant results and make so much difference in the life of many of the patients that I saw that came from pretty poor backgrounds, and seeing them once was probably your only chance. So I found it very gratifying, and I think for many of us, that instant gratification to see that you can make a difference gives us professional satisfaction. So I think that's what keyed me in when I was very, very young. I was probably not even 20 at the time, and I decided that was what I wanted to be.
Wow, that is really nice. How about the ASC? How did you first become involved with the ASC, or how did you even hear about the ASC?
So for me, a lot of my professional development and career, once I came to the United States, has been a mentorship and the people that I was surrounded by that have influenced me and my career so much. So I was a resident at the George Washington University in Washington, D.C., where all the anatomic pathologists, surgical as well as cytopathologists, practiced cytopathology every day, because that's how we did our frozen sections, except for the frozen section margins. Everything else was free cytology. So we sort of, anatomic pathology for all of us meant the constant correlation of cytologic smears during intraoperative consultation and the final report. And I was very motivated and encouraged to see the professional involvement in several societies of all of my teachers and mentors there, from my big daddy in pathology, Steve Silverberg, who's not a cytopathologist by subspecialty expertise, but certainly practices cytopathology and did so on a daily basis. And then Mary Sidawi, another ex-president of the ASC, Sana Tubara. The list is Yolanda Hotel. The list is endless. I was surrounded by all this expertise in cytology and people who I saw involved so much that I decided that I wanted to be able to make a difference like they did, and I learned from them very early on that volunteering your efforts towards your professional organization makes you grow personally, but also is a payback in a way for you to be a part of your specialty, whatever it might be, and influence how it's foreseen by all other medical specialists. So I got involved. I became a member when I was a second year resident in pathology and of ASC and of several other societies. And probably my greatest professional satisfaction, and I would say my growth in pathology and cytopathology, has come directly from my professional cytology involvement and all the wonderful mentors and teachers and friends that I've made along the way.
This is Dr. Stefan Tambuchian, who is a professor of pathology, the director of surgical pathology at Loyola University Chicago. He recently joined Loyola. Prior to that, he was at the University of Minnesota and the director of cytopathology there for the last 15 years. Welcome.
Thank you for having me.
Dr. Tambuchian, you are a well-known cytopathologist. So tell us, how did you find your way into this field?
Well, it's a pretty complicated and long story, but...
Oh, would love to hear that.
Well, my father was a pathologist, so you would imagine that it was a shoo-in, but it was very far from that. I first got into primary care and family practice, and then by an accident, real accident, I got into pathology in the first place. And then I got enamored with pathology. Certainly, you know, if you have any interest in solving puzzles, pathology is the place to be, because there, not only do you have the puzzle, but usually you have a final answer to your puzzle, whereas in other specialties that is not entirely true. So it gives you a lot of, you know, professional satisfaction to start looking at a case that is very complicated and puzzling, and then get an answer to that. The other thing that is very important to me is the aesthetics. I think that I was always in love with colors, and the slide colors are very interesting, but I think that cytopathology has the most interesting gamut of colors, and even in you know, Romanowski type stains where you have only basically one color, it has so many shades of purple to pink that you can fall in love just with the beauty of the colors. So that's another thing that I liked in cytopathology.
So how about the American Society of Cytology? How did you become involved? How did you decide or choose to be a member of the society?
When I became the supervisor, regional supervisor for the we are 4-hospital system, and then my pathologist, Dr. Boutsos, told me, why don't you become a member for ASC, because they have really good things about an ASC listserv. So that's how she introduced me, and I'm so thankful to Dr. Boutsos, because that is such a valuable resource listserv. Anytime I have a question, I send a question to the listserv, and so many people, so many experts. The one thing that really impresses me is the pathologists, how they give us the opinion, what is the right way to do, what is not, and then the cytotechs with all their experience. So it's like I have my own group of people helping me to do this, do that, giving me different opinions. So I think anybody in cytology field, whether they are a supervisor or no, should be part of the membership, should have membership and should be part of the listserv.
We should recruit you for the membership committee.
No, it's really valuable. For me, my hospital actually pays for the membership because they realize the importance of being a member for ASC.
Oh, that is very nice.
Yeah, that is very nice. I mean, I will pay from my pocket, but they pay for it.
Now, how did you first get involved with the American Society of Cytopathology? What were your motivations, and how did you hear about the society?
So as I was preparing to enter my cytopathology fellowship, here by the way,
at Loyola, yes.
Right, yes, I became a member of the ASC, and I think my first exposure to what the ASC could offer me as a fellow was actually through the progressive evaluation competency. Yeah, the 3 tests that I took during my fellowship. So that actually was great for me, because that was a way that I could evaluate my own performance.
And did you think it helped for your boards?
I think it did, because it actually gave me an idea of areas that I performed better in versus areas that I had opportunities to do better in. And then those were those areas of opportunity where I could focus my studying as I went forward in my fellowship and got ready for my board exams.
As a fellow, what does the ASC provide you with? What does the ASC help you in terms of professional growth?
Sure. So when I first started fellowship, there's something called the PEC exam.
Progressive Evaluation and Competency. Okay.
So we take that 3 times during the fellowship, once at the beginning to kind of see where our starting point is, and then again in the middle and at the end to kind of quantitatively evaluate how we're doing throughout the fellowship, to see how we've progressed throughout and to see hopefully how well we'll do on the board exam.
I'm sure you'll do great.
So that's the first tool that I really got from the ASC when I started fellowship. And then also they have e-journal club section, which is now free, which I'm very excited about. So that when I just have a little bit.
What do you do with the e-journal club, for those who don't know about it?
So it's just a list of articles that are kind of in the forefront of cytopathology from a number of different journals. So when I have just a little bit of time, when I know I'll be able to only read 1 article during the day, just for a little free time, I can go to the website and just find the articles that are the most pertinent to the practice today, and just read 1 article, and then some of them have questions associated with them to kind of gauge my understanding of the article and maybe do a little bit more follow-up. So I really like looking at those when I just have a little bit of time, rather than picking up a number of different journals and trying to sift through it and spend my time with that. I can really focus on the articles that are important to the practice of cytopathology.
to hear.
And then, of course, their annual meeting. So it's an opportunity to present research that has been done in the field and also network with other cytopathologists and people in the cytopathology field, and to learn about new things in the field through the presentation, learn more through the courses, kind of in all one concentrated time and area.
So how would you say that the ASC has changed you, or your practice, the way you look at cytology over the years?
Changed me personally, I guess I would say again has made me grow professionally as a cytopathologist, but has I think made me realize that I can make a difference. And I to anyone who's hearing me say this, I would say that so can you. Any of us who want to can actually have an impact on our profession. And I've brought back a lot of expertise that I've learned through educational programs that I've attended. I've also had the opportunity of having been the scientific program committee chairman for the ASC, so I felt I made a difference in offering cutting edge programmatic needs that were identified by our society members and professionals. So in many ways, I feel I've given less than I've received back in many ways from the ASC as well as other professional organizations. But being a cytopathologist, the closest I guess family is the ASC.
That is very nice and very inspiring for the young generation. How about the American Society of Cytopathology? How did you learn about the society? Why did you choose to become a member so many years ago? What happened?
Well, I had a very good mentor in cytopathology, Dr. Jenner Rozan, who took me for a fellowship at Johns Hopkins. The first thing he asked me is, "Are you a member of the ASC?" I didn't even know what the ASC is, so I said no. So he said, "Well, this is the application, apply now." And I became a member in my first months of being a fellow. So, and so the membership was for him the most important thing for your professional future in cytopathology. So I think it's still true today. I mean, membership in the ASC is very important to be part of the community, to know how things are working and where we want to go and be contributing to that future of our specialty. So I think that that's very important even now. But then when you are a fellow and just get into it, then it's really important to become a member.
Well, I've been a member of ASC for 43 years.
Congratulations.
Thank you.
Very happy to hear that as the chair of the
Yeah.
membership committee.
And when I took the International Academy exam, then you had to keep your credits up. Every 3 years you had to have continuing education credits. So the best way and the nicest way was to go through the ASC, take their workshops, attend all the platform presentations.
Mm-hmm.
And I was lucky because most of my employers encouraged it, and they paid for me to go to the meetings. I probably went to all the meetings, maybe missing one or two.
Is that right?
During my career. Even at College of American Pathologists, they would send me to all the ASC meetings. So,
well, once again, congratulations. It's
Thank
so
you.
refreshing and wonderful to hear of people who actually are attending the annual
Mhm.
meetings year after year.
well, I love the meetings. I wish I could go this year, but I'm going to Mexico instead. So,
Well, I'm sure you'll have fun there too, but we will miss you at the meeting. So how did you first become involved with the ASC? How did you become a member of the ASC?
Well, being a mentee of Suzanne Selvaggi and Dr. Naylor, that was kind of natural way that I have to become a part of the family, officially part of the family, becoming a member. And exactly my first presentations were the posters, which I've done with Suzanne, and standing in front of those posters, I felt like on the top of the world. I was so proud of myself being there and presenting. And again, this is extremely important that the society still provides this platform for the young residents and fellows to be able to present their studies.
I've taken advantage of the annual scientific meeting. That's a really great place to not only meet, but also learn from leaders in the field of cytopathology. Another avenue that I take advantage of is listening to and learning from the eCyto conferences. And those are the ones that can really help me as I progress toward maintenance of certification. So I'm one of those that has a time-limited board certification.
Lucky you.
Yeah, I know. So I have to, I mean, it's a constant process of recertification that we have to deal with. So actually the ASC provides a really nice way to accumulate not only general CME credits, but also the self-assessment modules that are a necessary part of the recertification process. So the webinars really are a good way to accumulate those and satisfy that requirement.
So what would you say the major accomplishments of the American Society of Cytology is so far? What are the strengths of the society?
The one thing I like was when the workload for the imager, we use imager. When the workload guidelines came, or when they find there is just some problem with that the pap mills were asking to screen so many slides, and they always look at the patient safety, and then is it helping them or is it hurting them? So that's where, when they are conducting the seminars, unfortunately I can't attend the meetings that often because of the budget constraints, but I think they do address all the present issues in cytology. It's just not research, it's just not pathologist oriented. They include the cytotext in it. So when I come to the ASC meetings, there are enough topics addressing what is interesting to me as a cytotech. So I think that is the good thing they are doing. They are keeping us as part of the team members.
Yes,
not on the
definitely.
periphery.
We are all
Yes.
together in it.
Right, yes.
United we stand.
The American Society of Cytology is the largest professional organization composed of our core practitioners, the cytopathologists and cytotechnologists, who, as you know, and all of us who practice cytopatology know, are a team. One can't really function very well without the other. And the mission of the American Society of Cytopathology is to promote the cytologic method as relates to clinical patient care, not only in diagnoses these days, but of course also in giving prognostic information, in targeted therapeutics and research. And we are facing challenging times now, not only in cytopathology, but in healthcare and medicine overall. And the ASC, like all professional organizations, has re-looked and re-emphasized our core missions of education and advocacy. And Lydia Howell, our current president, led us to re-look and update our strategic plan. And those who are attending Las Vegas meeting will hear about this new strategic plan. Our incoming president, Andy Renshaw, has a wonderful new tagline for us, which is saving lives one cell at a time. So I find that really inspiring. That's what we do every day. But we realize the challenges that face us in preserving our discipline, and we need all our members to come on board to help us face these challenges. But because there are lots and lots of opportunities that come with challenges. And again, it's up to us to define our existence and our growth. And I believe we have the expertise among us, and the minimally invasive, excellent practice of cytopathology is very well placed to have a major impact in the cost containment that future healthcare will bring.
What do you think the future of cytology is?
So I think it's only going to grow. One of the biggest thing in healthcare now is cost-effective medicine. No one wants a large surgery when they could just have an FNA done, or a voided urine specimen when they don't need some invasive surgery. So I think the field is only going to grow. The patients appreciate not having a large surgery when they could have a procedure done in the office and then go home the minutes later. So I think also that we need to be able to discuss with clinicians what they're looking for from cytology as well, so that we're sure that as the field grows, that we don't lose sight of what our purpose is, to serve the patients and help the clinicians guide treatment for those patients.
I think that cytology has a very interesting and complex past, and it started from a purely morphologic specialty, and I think that morphology is still the basis for any good cytopathology, but I think it's just a stepping stone. I think that we have to incorporate and as a specialty embrace all the molecular methods that can be applied to a cytologic sample, and we have to be there first and keep it up with us. I think that the tendency now, even in academic places, is to outsource anything, including most molecular tests that you can do on a cytologic specimen. I think that there are advantages to outsourcing. It's cheaper, but there are big disadvantages to outsourcing. You're not keeping in contact with this whole new field of developing field of individualized medicine, and in a sense cytopathology should do most of the techniques that are looking at molecular events at the level of a cell, not in a gel or in another form, but at the level of cells we are still better than anybody else in recognizing which one the cell of interest is.
You mean like more fish techniques or CISH techniques?
Yeah, fish, CISH, any technique that has a morphologic substrate. I think that we can still compete with anybody in recognizing the abnormal cells and trying to read only the ones that we think are abnormal for whatever molecular technique we are using. So,
I think molecular is the future, and I think all cytotechnologists should have some knowledge of molecular pathology.
There are several challenges in pathology in general and cytopathology in particular that come to mind, but one thing is that as potentially over time that the PAP test numbers may be going down, we can band together as pathologists and cytotechnologists and emphasize the possibilities and the future directions of molecular pathology as we move forward as a profession. So maybe we could leverage our strengths together and find ways to be on the forefront of medicine and not lose our position in diagnostic medicine.
You know, cytopathology is like looking at pieces of a jigsaw puzzle, and you're missing a lot of the pieces, and that's challenging. You have to figure out what you're dealing with, and now the challenge is actually in many ways easier, but it also makes it imperative that we as cytotechnologists and cytopathologists have learned all the other clues that will help us complete that jigsaw puzzle and be able to make all the diagnoses and prognostic and therapeutic decisions that today's medicine demands. And this is only going to increase as we go further.
For the people who are just going into the field, what would your advice be?
People should always remember that when they're looking at a slide, you know, take your time and make a good interpretation.
If you haven't chosen your area of subspecialty expertise yet, then consider cytopathology. It's a very fulfilling specialty. I think it still allows you a lot of input, as does all of pathology, but cytopathology specifically, you can choose to see patients if you want to, and you almost have to practice in a very strong multidisciplinary manner, no matter what kind of practice setting you're in, if you want to give well-rounded and more definitive diagnosis. So those of you who have already realized and loved cytopathology, as all of us who are cytopathologists, then be aware of all the developments around you, and again, I advise you to get involved in your local institution beyond just your daily work, and then be members of professional societies, ASC and other societies, and we all have a different skill set to offer, and there's always a place and a committee or an organization that will fit the particular wealth of knowledge or expertise that you can bring to it. So remember that just practicing on your own and then not being happy with how things turn out can often be mitigated by getting involved yourself, and you'll realize how fulfilling that is.
For a new cytology student, I think they should really keep their options open and be open. Cytology, HPV, flow cytometry, whatever is offered, be knowledgeable about it, and be open to learn the new methodologies and new technologies. I think that's very, very important for the new cytotechnologists. It's very important.
Anything else you'd like to add about cytology or the American Society of Cytology in general?
I mean, cytology is the greatest field, hopefully all of you agree. That's why we are in cytopathology. It's very visual, it's fun, it's stimulating, it's like a little puzzles trying to figure it out, what's really behind those few cells. So I cannot imagine doing anything else. And again, it's very important that we really truly unite all members, everybody, whoever is doing cytopathology in one way or the other, to become one society under one umbrella at least, to be stronger and be really heard.
What is your advice?
Well, I think that they first should become members of this society, of the ASC, and then become involved in the workings of the society, not just becoming members, but actively becoming members. I think that it's the best way of feeling the pulse of our specialty. If you want to be a good cytotechnologist or a good cytopathologist, you have to see where we all are and where we want to go, and be in the forefront of that.
You know, I just this morning read our current president, Lydia's president's message that is on our ASC blog now. And for those of you who've been watching this, Lydia has always tried to bring a non-cytologic theme to tie things together. And the message she posted today, I think, is something we can all keep in mind as we go into our 60th anniversary meeting in Las Vegas. And that was, when you come to the meeting in Vegas, who are you going to be? And if it's your first meeting, or even if it's not, and you don't know a lot of people, introduce yourself. You'll be surprised as to how friendly people are. And once you open the door, try to open the door, you'll be enveloped in a lot of warmth, and you'll feel much more involved. So we look forward to welcome you all. Looking forward to a great meeting. You'll learn a lot about the history of ASC. You'll learn a lot about what the leadership is planning for the future of cytopathology. And we'd love to hear from you and have you get involved so you can help us take care of the profession that we all love and want to see become more and more successfully utilized in the practice of medicine.
ASC really truly united all of us who love cytopathology, and I'm not talking about only cytopathologists, but cytotechnologists, everyone who are in the field. ASC put the cytopathology on the map of pathology, make it legitimate specialty, and it's really representing us now, setting the guidelines, standards, and making sure that we are heard, and really again, making sure that cytopathology is recognized. And frankly speaking, I always was thinking about it, the future of entire pathology.
So if you have advice for the future cytologists, for the both pathologists and the cytotechnologists, what would it be? What should they do?
Join us.
Yes, I completely agree with that.